Assalamualaikum warahmatullahi wabarakatuh, and greeting to Dr. and everyone. My name is Dr. Fazin, and I'm the leader of this group.
Introduction. A vascular graft implant is an act of artificial conduit or substitute for a diseased artery. The graft material will be inserted into intact tissues or a body cavity. The function of vascular graft is a treatment for the long revascularization of occluded vessels in surgery utilizing vascular graft.
One from this study case is thick collagen shell cover the vascular graft and black light fill the blood vessel. So the biological response that happened throughout the implantation is first, injury that happened during the operation. Second, the blood material interaction that happened during the vascular graft is implanted. Third, provisional matrix formation that occur yearly within minutes to hours after the operation. And second, the inflammation. In the biological response, they have two inflammation. First, acute, and second, chronic. The body having the rejection, so the inflammation that happened inside the body is a chronic inflammation. So the inflammation will happen proliferation of blood vessel and connective tissue. And lastly, foreign body reaction that inhibit the healing. First approach is using immunosuppressant drugs. Immunosuppressant or anti-rejection drug will lower the body ability to reject a transplant organ. The immune system will know the new organ is not part of the original body. It will perceive the new organ as a threat and will try to destroy it. So this drug will help to control this response and protecting the new organ. There are two categories of this drug. First, induction drug, anti-rejection drug that used at the time before the transplant to about 2 to 12 weeks after it.
The example of induction drug is monoclonal and polyclonal.
Second, maintenance drug is an anti-rejection medication that used for prolonged period or may be lifelong.
And also the example for maintenance drug is prednisone, a type of steroid, and also sirolimus, a type of mTOR inhibitor.
So second approach is to develop more compatible graft. As we know, biocompatibility is vital to avoid body rejection. Therefore, we need to develop more suitable graft to avoid rejection. We can use acellular, extracellular matrix scaffolds derived from xenogenic vascular tissue. This material also has a higher resistance to infection and can be treated by antibiotic. Third approach is use regional antibiotic release. Infection after vascular graft implant is a serious and life-threatening complication. It is the one of the reason of rejection. The risk can be reduced by using the regional antibiotic release method. The most frequent first choice drug was amoxicillin and amoxicillin clavulanic acid as second choice.
NMJ20103 is a series of standards for evaluating the biocompatibility of medical devices which manage biological risks. NMJ20103-1 is a necessary evaluation system that shall be selected correspond to the natures and durations of contact of individual medical device with the body. Artificial vascular grafts are used in the surgical bypass operations to rotate the directions of blood flow within the body. They are used for a variety of medical needs, for example, including coronary artery bypass operations, and provide vascular access for hemodialysis treatments after kidney failure. Intentional supporting contact is categorized as an implantation medical device based on ISO 10993-1. The artificial vascular graft is directly in contact with blood as it plays directly in the blood vessels to control blood circulation in the body. It is in type C known as long-term exposure to blood for more than 30 days.
There are many kinds of biological evaluation of material device. Some of them are cytotoxicity, which caused by the chemotherapeutic agent on living cells. Then, sensitization is action of making organism abnormally sensitive to foreign substance. Irritation, on the other hand, is discomfort to body parts caused by irritant substance. Material-mediated pathogenicity is contaminating may occur during production. Acute systemic toxicity is short-term toxic effect appears soon after swallow, absorbed through skin, or inhale. Subacute toxicity is effect occur after the administration of a single dose or multiple doses per day. Subchronic toxicity is effect occur administration more than 90 days. Chronic toxicity is effect of long-term exposure to the toxicant. Implantation is device or material placed inside or on the surface of the skin. Hemocompatibility is to check the compatibility of material to blood. Genotoxicity is the ability of substance to harm cells. Carcinogenicity is the ability or tendency to produce cancer.
What is synthetic vascular graft? Vascular graft are the tube replacement of an artery or vein segment. Synthetic prostheses are the preferred conduit for the large vessel reconstruction and the primary alternative to the saphenous vein in small vessel repair. A synthetic polymer is used to develop a new synthetic vascular graft due to its certain properties. When the synthetic graft is used in the blood vessel, the body grows a new lining to the graft over time. The lining is similar to our natural blood vessel lining. The synthetic polymers, which are EPTFE and Dacron, are proposed to develop a new synthetic vascular graft. So what is EPTFE and Dacron? Expanded polytetrafluoroethylene or EPTFE is a membrane created when PTFE, a linear polymer consisting of fluorine and carbon molecules, is expanded. Dacron, also known as polyethylene tetrafilate, PET, is produced by polycondensation of ethylene glycol and tetraethylic acid. Material that propose as synthetic vascular graft. EPTFE graft is a synthetic polymer of carbon and fluorine produced by mechanical stretching. Dacron graft is constructed from multi-filaments yarn and fabricated by weaving and knitting.
Now, I'm going to talk about the design considerations for the graft. The design considerations consist of chemical, morphological, and mechanical properties of the EPTFE, expanded polytetrafluoroethylene, and Dacron that have been selected. For chemical properties, EPTFE is bioinert, non-toxic, therefore will not harm its surroundings such as blood, can be used at high or low temperatures, has low chemical reactivity. For Dacron, it is biocompatible with the body, in which rejections and calcifications will not occur. Bioinert, it will not interact with the surrounding environment easily, has a long-term biostability, and does not contain harmful chemicals. For the morphological properties, EPTFE is a porous polymer. Its smooth surface decreases the possibility for thrombosis to occur. It is soft, flexible, in sheet-like, and has an irregular cross-sections. Next, Dacron. Dacron can be divided into kneaded and woven form. However, kneaded form of Dacron is more recommended for designing a synthetic vascular graft. This is because a kneaded Dacron graft has high porosity and has an inherent structure, softer and more flexible, therefore it is easier to handle, and it is also compliant. Lastly, mechanical properties. EPTFE has a great thermal stability and decomposes at 508.6 degrees Celsius. EPTFE also is a hydrophobic material with water contact angle of 120 degrees, high strength to weight ratios, and low elastic modulus. For Dacron, when it is creamed longitudinally, flexibility, elasticity, and heat resistance can be increased. Dacron also has a good stability, higher linear stress response, durable, and has a long-term performance. Therefore, it can be said that EPTFE and Dacron is a suitable materials that can be used for designing a synthetic vascular graft.
The studies biological response that happen throughout the implantation period is a foreign body response. The three approaches that can be used to overcome this problem are using immunosuppression, developing more compatible graft, and also using the regional antibiotic release. Besides, the biological evaluation of the artificial vascular graft is determined based on ISO 10993. It is directly in contact blood and exposed to blood for more than 30 days. A new synthetic vascular graft was proposed using EPTFE, which is also known as expanded polytetrafluoroethylene and Dacron as the new material codes due to their appropriate chemical, morphological, and mechanical properties.